This video will demonstrate proper technique for drawing peripheral blood cultures. Prior to starting, verify the patient identity by using two patient identifiers. Ask the patient to verify his name and date of birth. Compare this with the armband as well as against the specimen labels. Be sure to explain the procedure to the patient. Having the correct volume of blood in each bottle is key. Place each bottle on a flat, level surface and get eye level with the bottles. Using the 5 milliliter marks on the edge of the label as a guide, mark the fill line at 8 milliliters above the broth meniscus level. The optimal blood volume in each bottle is 8 to 10 milliliters. By marking at 8 milliliters, this will ensure that there are no overfill errors. The overfilling of blood culture vials results in false positive blood culture results, leading to increased testing, cost, and length of stay. After gathering all supplies, remove the plastic caps from both the aerobic and anaerobic blood culture bottles. Wipe the tops of each with a new alcohol pad per each bottle. Scrub for 15 seconds and allow to air dry. Then perform hand hygiene and don non-sterile, clean gloves. Apply the tourniquet to the patient's arm and locate the vein that's going to be used. Activate the chlorhexidine applicator by squeezing the plastic wings, then shake to moisten the sponge. Using gentle side-to-side motion, scrub the site for 30 seconds and allow to dry for 30 seconds to 1 minute. If the skin is visibly soiled, the skin must be cleansed for 2 minutes and allowed to dry for 3 minutes. It is important to note that the area that has just been cleansed should not be touched or palpated after cleansing. If repalpation is necessary, don a new sterile glove. Perform venipuncture by holding the wings of the butterfly with the bevel pointed upward. It is important to note that the skin may be retracted to aid in venipuncture, but the site must not be contaminated. If contamination occurs, you must use a new chlorhexidine scrub to re-prep the site and allow to air dry. After successfully performing venipuncture, you may secure the wings with paper tape if necessary. Place the standard needle holder over the neck of the upright aerobic bottle so that its stylet punctures the septum. Allow the vacuum to draw the blood into the bottle until the level reaches the 8 milliliter fill level without going over the 8 milliliter line. Remove the needle holder from the aerobic bottle and fill the anaerobic bottle in the same fashion. Remove the tourniquet, remove the needle from the patient, immediately activating the safety device. Cover the puncture site with gauze and hold pressure until bleeding stops. Correct labeling of each bottle is important. Be sure to label the bottles at the patient bedside to ensure proper patient identification. Be sure not to place the label over the barcode or cover the area where the fluid is visible. This can cause delays in result time. Mark each bottle with the date, time, initials, and location of draw. For example, blood culture drawn from a peripheral site from the right AC, the date, time, and your initials, and be sure to write clearly.